you have hip osteoarthritis, should you go straight for surgery, or could exercise give you the same relief? Hip osteoarthritis is one of the most common causes of pain and disability worldwide, affecting over 33 million people. And for many, it feels like surgery is the only solution. Across Europe and Australia, the lifetime chance of undergoing total hip replacement is between 8 and 16%. Every year, more than 1 million hip replacements are performed globally. And that number is expected to surge by 284% in the US by 2040. I'm Marius Visser, a biokineticist at the Oncology Center, and today I'm comparing total hip replacement surgery to resistance training. Which one should you consider? Total hip replacement has a well-earned reputation for relieving pain and improving quality of life. In fact, up to 86% of patients report satisfaction just 6 months after surgery. But here's the question most people never ask. Is surgery always the best first step? Could a carefully structured resistance training program deliver similar results without the risks, cost, and recovery time of surgery? Today, we're looking at a landmark randomized trial that put progressive resistance training head-to-head against total hip replacement. The result might surprise you. Hip osteoarthritis wears down the cartilage that cushions your hip joint, leading to pain, stiffness, and difficulty with everyday activities like walking, climbing stairs, or simply standing up. Over time, this can lead to a loss of independence, reduced activity, and even further health complications. That's why surgery often seems like the obvious fix. But what's less well known is that there's a lack of randomized trials comparing surgery to non-surgical treatments. In fact, for some orthopedic procedures, research has shown that surgery isn't necessarily more effective than conservative management. The gap in evidence is exactly what the PROHIP trial set out to address. The PROHIP, or Progressive Resistance Training versus Total Hip Arthroplasty trial, involved patients 50 years and older who had severe hip osteoarthritis and were already scheduled for surgery. The goal? To determine whether total hip replacement would provide superior results compared to a structured progressive resistance training program. The focus was on patient-reported hip pain and function, real-world outcomes that actually matter to people living with this condition. And why resistance training? Well, because evidence already showed that exercise is one of the most consistently recommended non-surgical treatments for hip osteoarthritis. Resistance training in particular had been shown to moderately reduce pain and improve function even in those waiting for surgery. But no one had ever put the two approaches head to head. Well, until now. So what did the programs look like? On one side, we have total hip replacement, a major surgery that replaces the damaged joints with an artificial implant. While effective for many, it involves hospital stays, surgical risks, and months of rehabilitation. And on the other side, the resistance training group, followed by a progressive program targeting the muscles around the hip, including the glutes, the quadriceps, the hip stabilizers, and the sessions were supervised, ensuring proper form and gradual progression over time. The exercises included a leg press or a sit-to-stand variation, think your chair squats, hip abduction exercises, step-ups, and core stability work. And the goal was to build strength, stability, and mobility, the same elements surgery aims to restore, but through training the body instead of replacing the joint. Here's the key. All participants were eligible for surgery, meaning these weren't mild cases. These were individuals with significant hip pain and functional limitations. So, which worked better? After following the groups, researchers compared the outcomes, and here's where things get interesting. Both groups showed major improvements in hip pain and function. But, and this is crucial, the resistance training group experienced improvements that were surprisingly close to those seen in the surgery group, especially in patient-reported pain and functional scores. In other words, for a significant number of participants, structured resistance training alone delivered meaningful relief and improved their quality of life. Some participants who were initially scheduled for surgery even chose to postpone or cancel the operation because their symptoms improved so much through exercise. Of course, surgery remains a powerful option for many, but this trial shows us something profound. Exercise isn't just a holding strategy. For some, it can be a highly effective treatment in its own right. So what's the takeaway? Hip replacement surgery can transform lives, but it's not the only path to pain relief and function. The PROHIP trial reminds us that your body has remarkable capacity to adapt and strengthen, even in the face of severe osteoarthritis. If you or someone you love is facing the decision of surgery, talk to your healthcare provider about starting a progressive resistance training program first. For many, it could reduce pain, improve mobility, and maybe even delay or avoid surgery altogether. If you had surgery or considering surgery, check out this full hip replacement home protocol. It includes pre-op exercises prior to surgery to give you the best possible outcome and speed up your recovery. I have also included a program for getting off your crutches, a hydrotherapy program, and all the rehab phases needed to get you back stronger than before. But following surgery, you also need to recover, and that's why I included dietary guidelines to help speed up your wound healing and muscle recovery with the best food choices. In the comments, let us know, have you or somebody you know tried exercises before hip surgery, and what was your experience? And don't forget to subscribe for more evidence-based mobility, strength, and healthy aging content. See you next time.